Good evening.
Thank you very much for coming here. Everyone's talking about COVID-19 again, especially because at least one city in Sri Lanka, in the police area of Gampa, is subject to curfew. A large business there had found a significant number. What went wrong? How come this, every business, any place you go, you have the now almost normal water, soap, sanitizers, masks, temperature checking. What went wrong, do you think? How come this was missed?
Yes, it's a very important question, because as a country, Sri Lanka has been doing very well compared to many other countries, and there were the government approaches and the health sector and all the good practices were there, and the number of patients were actually going down, and during last 2 months there weren't any patients that was found from the community. So where it went wrong? Probably while the situation was slowly stabilizing, the required amount of, say, alertness got little relaxed.
Right.
However, I don't think we can blame any person, any party or general public,
right,
because this relaxation, the relaxed attitude was observed at all levels, at all sectors.
This laxity.
General laxity was there. However, the situation actually called for more maintained and sustained approach, what we call the new normal. New normal is what we call that once in this kind of pandemic, you can't go back to the previous behaviors,
right,
because these kind of pandemics tend to last long. This is like running a marathon. I think if you could remember the discussion that we had in April,
yes.
Yeah, we at that time also we discussed that this is going to last long, so we had to adapt to this situation, and generally the country was doing well, but the situation called for a maintained approach of those good practices, like the good health practices, behaviors, all these things. What was required was the new behavior to be established.
Right.
But what was observed was it has gradually got laxed. Maybe due to many reasons. Actually, in many countries, in the history also, if you take the history, after many pandemics this happens. Initially there is alertness,
yeah,
but as time goes on, the relaxed attitude sets in. That's the human nature. It happens. So I don't think we can blame anyone,
no,
but I think this time to rethink and re-establish that pattern and find out where we have gone wrong.
The suggestion or the requirement to maintain social distancing seems to have gone out of the window. I've noticed on every morning the commuter train coming from the south into Colombo, it's the people are packed rather like in sardines, and quite often you see a number of people not even wearing a mask. But what's the point? Because even if you did wear the mask, it's, they're packed together literally face to face, really like that. And if you ask some of these commuters, they'll say, well, we don't want to get to work late. But we don't see any move to increase the frequency and the capacity of trains. So instead of having one and then the next one 10 minutes later, maybe, or 20 minutes later, you need to have one back to back, so that the people can spread out and not be so clustered. What do you have to say about the state of public transport, where it is run by the state?
Yeah, I think there are no easy answers there, because even if you leave out the COVID-19, a decent public transport is a must. Even if you take the current traffic congestion or even the road traffic accidents and the number of deaths due to that, for all these, one definite answer is a good public transport system. And answer to your question related to COVID-19, this shows that there is no one measure that would be effective in controlling, because when you take the realities of the context, there may be certain situation that maintaining the 1 meters or 2 meters distance is impossible. So that is why we need to go for multiple approaches. I mean, there are simple public health approaches that were prescribed and as considered as very effective in controlling this situation. For example, covering your mouth and nose with a mask in a proper way, and then proper hand washing, ideally with soap and water, or if not with the alcohol sanitizer, and maintaining physical distancing. Actually, all these things are based on science, because based on what is known about the coronavirus, which is susceptible to soap and water, because it's covered with this small virus is covered with, say, lipid layer, so it dissolves in soap and water or alcohol sanitizers. And also, again, research has shown that this spread is mainly through droplets, infected droplets, and when someone sneezes, the droplets can move in a very fast, rapid velocities for about 1 to 2 meters distance. So based on those principles, that's how these basic, very simple public health measures came up. In contexts like ours, where the facilities are minimal, I think it's very important to go for a range of approaches. Yes, public transport, yes, I mean, definitely we have to. Probably we might have even missed the golden opportunity during the lockdown period, where the amount of usage of public transport, or the amount of, say, the requirement was minimal. This could have been a time period where we could have experimented with a decent system of public transport, how to establish. But with the current demand, it's very difficult to maintain a decent.
So we appear to have missed an opportunity.
Probably we appear to have missed an opportunity.
But of course, it's never too late to start.
Never too late.
So listen up there, the General Manager of Railways. You need to listen to this and try to get your game right. Now then, I want to go back to the latest outbreak in big numbers, apparently.
Big numbers.
At this business based in the
Gampha district, yes.
Now, how come, presumably this business had all the new normal items like the water, the soap, sanitizers, temperature checks, and then this happens. How do you think, how did they slip through the net? Is it possible to have to display symptoms and evade the temperature check, or the temperature check was showed you normal but you still carry it?
It's very possible. I mean,
it is possible.
It is very possible. This shows us one thing. I mean, if the conditions are there, the conditions for spread are there. I mean, generally, if there are crowded places where a lot of people are there together in a close confinement, probably ventilation is not ideal. In those situations, if these situations are there, I mean, then the spread will be like wildfire. I mean, this was what was shown in all the clusters that we have seen so far. All these were confined areas where there were a lot of people who were living in a close confinement for longer duration. That's the ideal condition for the spread. So even 1 or 2 were there that have been leaked into the community, they could have got into these situations and then started this. So yeah, large numbers, yes, it's very scary, very alarming, but it can happen.
And it is entirely possible that the person who was first sort of identified as being positive at that business may well be not responsible for the spread.
Very possible, very possible. I think this is something that I really want to highlight.
Yeah.
In epidemiology, we talk about something called index case.
Right.
That is basically for a particular cluster, the patient or the case which started off, triggers off, and from that patient it goes on to, generally one person can spread to about 2 to 4. It can be higher, but generally around that, and it goes on. So that person is what we call the index case. This patient was the first patient to be detected, but may not be the index case. Again, to further explain how this patient was detected, in Sri Lanka, if someone is suspected to having COVID symptoms, maybe the contact history and fever and other suggestive symptoms coming in, then COVID testing happens. But there's no way to test everyone who is coming with fever to test for COVID, because if you take a government hospital, thousands will be coming to the OPD, and then so many others will be admitted to the wards. There's no possibility of testing everyone who is coming with fever for COVID. However, in Sri Lanka, there's a policy established to randomly screen everyone who gets discharged after being admitted for fever.
Right.
That is what we call ILI screening, influenza-like illness screening. So basically, that is, even though they may not be tested for COVID because it may not be typical COVID criteria for testing, but still another layer of defense, like another layer of screening before they get discharged, that they are screened. So this patient was admitted for fever and not tested as COVID at the first instant, but during the screening it was found out. So in a way, this shows something, that this method has some benefits. That at one point she was missed out, but at the second point she was found out, and it was a lucky find, because it was because of that this suspect came up, that the contact tracing started and found out where this person works, and then they have basically cooperated, and then the testing was done, and lot of people were found out. And again, large numbers, initially 70, then going up to over 100, and today about another 300, about another 500, now totally the whole cluster has gone up to 700. And again, one thing that we have to notice is that once you get the virus into your body, it takes up to maybe about 2 weeks, few days to 2 weeks to get the symptoms after infection. So, and once the virus is in the body, then only it can be detected by this PCR testing, because PCR testing can detect the virus particles or the DNA, RNA material within the secretions. The RNA material conversion method in RT-PCR is very complex, very resource intensive method, and it can find out only if these viral genetic material is available in the secretion of that person, affected person. So it takes few days. So the fact that all these this patient as well as others, they were tested within a gap of maybe 2 to 3 days, and they all became positive. So generally we can safely assume that all of them got the illness during a close time, during a time period of maybe 1 to 2 weeks, like close time gap. So they got the infection together.
Indeed. Let's come back to this, Professor Karunathilaka, after a short break. Don't go away. After all, this is Newsline Live, and we'll be back after this short break.
News First, Newsline with Faraz Shaukutali.
And welcome back to Newsline Live. We are in conversation with Professor Indika Karunathilaka, President, Sri Lanka Medical Association, and we look forward to receiving your questions by SMS only, please, to 0772 300 305. Our wonderful producer Harshna will put it up on the screen for your benefit. Now then, Doctor, here we go. Professor, sorry. Is the government conducting these PCR tests efficiently, sufficiently, and methodically?
Okay, I would use the word rationally.
There.
I will explain. Now, there may be a perception that compared to maybe a country like US or UK, where they would be doing the PCR testing in maybe in millions, the numbers in Sri Lanka would be low. So you might feel that, are we doing it adequately?
Is that financial constraint?
Okay, there are several reasons. There are logistical reasons and there are scientific reasons also. Logistically, if you take, this is a very sophisticated and a complex test. What happens here is the viral genetic material is detected through a very complex testing system, it's not just taking the throat swab, but after taking, it's transported in a special media, and then there is a special mechanism where this material is sent through a special machine and several reagents, where through several cycles this viral material, genetic material, is amplified to an extent that it will be detected through a system. That is what we call this positive. To do that, you need the experienced technicians, doctors and specialists, and the laboratory people, and also you need these reagents, what we call the test kits. And it's a limited number that we have in the country, because some of the...
And why is that? Is that because of financial constraints or availability constraints? What is it?
Some of the materials, some of the complex material that are required for these test kits cannot be produced in this country. It's a very long elaborated procedure in producing that, and the countries that are producing also, because of the current pandemic, they mainly keep it for themselves. So what they are sending to our countries are limited numbers. So that is where this rational use is very important. And another thing is, since we have to use it rationally, for example, at the moment one might argue, why don't you test for everyone in the country, or everyone who is having fever?
That sounds a good idea.
That sounds a good idea, but may not be. I mean, I'll give one example. When someone goes to war, you have ammunition. When you start from the board, go for marching, you don't shoot all over the place. You don't do it in that way. I mean, it's a targeted way, because it's a limited number of resources. So it's the same thing applies. Imagine at the moment there are hundreds of patients. If there is a time comes, there will be thousands and thousands who are like contacts. Then they have to be tested. They must be tested. If we waste our resources right now, we will not have the necessary resources when we need it.
What do we need more? Do we need more roads right now, in this today? Do we need more highways, or do we need more PCR testing kits? Or do we need more ventilators?
Okay, ventilator is a different question. I'll come to that. I mean, in summary, I think we should stop this situation before we need ventilators. We should control this situation before we need ventilators. Therefore, having PCR testing in a rational way, and maybe we might have to upscale that definitely, very likely in a rational way, is more important than having ventilators, because we need to control. Okay, I'll get back to your question again a little bit more in detail about are we doing it adequately or inadequately. One good example, now this patient was found out. Imagine this patient was not found out. Then, I mean, why all these hundreds of patients are found out at the moment is because we have got one case and then all the contact tracing has started. If the system was not there, then this patient would have been missed. Then, so in that way, this also one evidence that this approach has some successes. I will give another example that I was mentioned previously, compared to say US and Sri Lanka. In Sri Lanka, the number of testing may be limited. However, having said that, in Sri Lanka, if you do 100 COVID testing, only about 4 or 5 will get positive. If you do the same test in UK or US,
with 100 people,
in 100 people, about 30 to 20 will be positive.
Why is it more there?
Because they do it in a more targeted way. Even though outwardly it look be very kind of free and approach to say very relaxed approach to testing, it is much more targeted than what we do, much more targeted. That's why, because only if you do targeted testing, then your yield would be more. But here it would be the coverage of scope is much more compared to those countries. But having said that, yes, there is a need to increase the numbers, but in a rational way. Again, people may be asking, why can't we do the COVID testing in every fewer patient? Again, practically not possible. Like I have mentioned, per day, thousands and thousands of patients are admitted with fever, and technically, logistically, that's not possible. Then you might argue, okay, now there is suspect about this being in the community, so why can't you randomly screen the whole community? It seems a good idea. It seems a good idea.
Yeah.
However, the issue lies in the way this test is done. This test will detect only the virus genetic material that is available in the body secretions. So if the viral genetic material is not there, then it will not be detected. That's why when someone gets this infection, in about 1 week's time, it starts appear in the body secretions. At that time, the person starts spreading the disease. And even after the COVID is negative, that means the detectable levels are low,
Yeah.
about another 2 weeks,
Yeah.
still it's possible that the viral material can appear in the body secretions. That's why this 2 weeks home quarantine regulation came into being. What I am trying to say is, you can be negative today but can be positive tomorrow, because it all depends on the detectability of the virus genetic material within the body secretions. So if you do randomly without considering the symptoms, then you may be doing the test on someone who is apparently healthy today, not excreting the material,
So-
and will be tested negative, but tomorrow that person will be positive. So
Yeah.
we will be missing out on that person, and that person will have all the confidence because the test was done, but will be spreading. But if you do targeted testing, then it's unlikely that we will be missing out. So I
And
think we should do more testing. There's no doubt about that. But it should not be carpet testing
Right.
or
It
just
should be
random
targeted.
testing, but it should be targeted testing.
Right.
That is what's happening at the moment.
And the question that everybody will want to know is this: how long will this pandemic last?
Okay, yeah. Again, I would say the same as I have given you about 6 months ago.
Yeah.
It's going to last long. I mean, it doesn't seem to be going away in a hurry. So we should be prepared for a marathon,
Right.
not 220. It's going to last long time.
Well, Doctor, unfortunately we've run out of time. I know that we started late, but what to do? You know, it's time for the prime time news now. Professor Indika Karunathilaka, thank you very much indeed for popping by. The message is, don't be lax. Take care, have a wonderful evening ahead of you, and as always, God bless each and every one of you.